still gonna get it. Losing is the new winning. So I'm not bringing home a winning crown. I'm not gonna let that shit get me down. I'm still that bitch. Don't you forget. So I'm not hung up in the Hall of Fame. I'm gonna act like it's there anyways. I'm still that bitch. Don't you forget. Ain't no stopping me, no stopping me, no stopping me tonight. No stopping me, won't stop me for the rest of my life. Look at us cry, we won't fall apart. We're just about to start, trust us, we're still gonna get it. Losing is the new winning. You try your best and you're still in last place. You try your stuff and fall flat on your face. You're still that bitch. You're still that bitch. Yeah, yeah. Don't you forget. Feel all the lows and you feel all the highs. Take all your fears and just kiss them goodbye. You're still that bitch. Don't you forget. Ain't no stopping me, no stopping me, stopping me tonight. No stopping me, won't stop me for the rest of my life. Look at us cry, we won't fall apart. We're just about to start, trust us, we're still gonna get it. Losing is the new Alyssa didn't win, but look at her now. Katya didn't win, but look at her now. Shangela didn't win, but look at her now. Hillary didn't win, but oh, whatever. Look at us cry, look at us cry. We won't fall apart. We're just about to start, trust us, we're still gonna get it. Losing is the new winning. I'm still that bitch. Don't you forget. Don't you forget it now. I'm still that bitch. I'm still that bitch. I'm still that bitch, bitch. Don't you forget. Don't you forget. Losing is the new. Losing is the new. Losing is the new winning. I'm still that bitch.
Thank you, Love Yourself TV's Quinesu, for that powerful lip sync performance of Losing is the New Winning from RuPaul's Drag Race. Magandang hapon po sa lahat. I'm Marvin Natural and I'm your host for today's hashtag Safer Now PH webinar on PrEP and PEP. This is in celebration of the Philippine National HIV Prevention Month 2020. Along with me is my gorgeous co-host, Ms. Stanley Duncan.
Salamat sa napakagwapo kong co-host, Marvin. Good afternoon, everyone, especially to our online viewers watching today's PrEP and PEP Day event. I'm Janly Dunca, your co-host. Kamusta ka naman, Marvin? I miss you.
Oh, I miss you more. It's been a tiring week. Salamat na lang at weekend na. How about you? How are you?
Good. Also, minsan nga hindi ko na nararamdaman yung difference ng weekday sa weekend, pero tuloy ang laban. Diba?
True. Okay, so today we are extremely grateful because we will be able to learn how to further protect ourselves against HIV on top of using condoms and lubes. Kaya naman sa mga viewers namin sa Facebook, Twitter, and YouTube, maaari nyo po bang i-like, share, and retweet ang free webinar na ito for your sexual health care. Don't forget to use our official hashtag. That's hashtag Safer Now PH. Again, that's hashtag safer now PH.
Correct, partner. Para mas marami tayong ma-inform about new ways for HIV prevention, nandito ang ating session for this afternoon. You can also comment your questions or thoughts about our topic today. Dahil alam naming marami pa kayong gustong malaman tungkol sa PrEP and PEP.
Pero bago tayo tumuloy, partner, pasalamatan muna natin ang ating mga partners and sponsors. The National HIV Prevention Month 2020 PrEP and PEP Day is spearheaded by the Global Fund SKIPA Philippines and Champion Community Centers Network, co-presented by AIDS Healthcare Foundation, sponsored by Rotary Club of Cubao, Quezon City, District 3780.
This hashtag SaferNowPH webinar on PrEP and PEP is also brought to us by Durex, Love It, 3M, Liss4, Luby, Clorelief, Usana Philippines, Easy Lubricating Jelly, Premier Condoms, Liquor Bouquet Philippines, and supported by UNAIDS Philippines, Filipinas Shell Foundation, Australian Federation of AIDS Organizations, APCOM, and Love Yourself, Inc. Also, don't forget to like and follow our social media pages. Philippine National HIV Prevention Month on Facebook, Twitter, and Instagram, at HIV Prev Month PH, and Champion Community Centers on Facebook.
The Philippine National HIV Prevention Month is celebrated July of every year. This is the first time that we are celebrating it, in line with Presidential Proclamation number 971, signed last June 23rd, declaring the second week of July as Infection Prevention and Control Week.
Correct, isang buong buwan, partner. Dahil nakita natin na kailangan nating punan ang kamalayan at kaalaman ng mga kababayan tungkol sa HIV prevention. Gayunpaman, dapat all throughout the year, dala-dala pa rin natin sa puso't isip na may magagawa tayo para labanan ang HIV.
That's really a great cause and mindset, partner. That's why we've invited two HIV physicians to help discuss with us two components of what we call HIV combination prevention. To know what the different HIV combination prevention methods are, let's all watch them.
Last August 8th, we talked about condoms and lube as an effective HIV prevention method. This afternoon naman, we shall discuss two more HIV prevention methods, PrEP and PEP. To give you a thorough explanation of what PrEP is, I am honored to introduce one of the brilliant young minds and hashtag hot doctors in the HIV community. You may have just seen him in the hashtag SaferNowPH video you've just watched. To talk about advancing PrEP in the Philippines, please, let's all welcome one of Love Yourself's HIV primary care physician, Dr. Patrick Eustaquio. How are you, Doc?
Hi, Miss Janly. I'm super good despite everything, and I hope everyone's doing fine. How are you?
Great! At inggit na inggit dahil nasa San Francisco ka pala today.
Yeah.
But thank you,
sunrise pa lang.
but thank you for being with us this afternoon, and we're excited to know more about what you're going to talk about. So take it away, Doc Pat.
Okay, thank you. Hey everyone, good evening. I'm sure it's probably a new thing for us to explore about PrEP and what it is. So let's start. So PrEP is short for pre-exposure prophylaxis, and when we dissect the words, it means that pre means before, and prophylaxis means prevention. So when we put them all together, it means that it before exposure prevention. So it is one of the HIV prevention methods available that is for us to use. So it prevents HIV by actually creating a steady level of preventive medicine in our blood. So as we can see in the next slide, that this medicine inhibits the enzyme reverse transcriptase. So here, as we can see marked by the box on this figure, HIV uses this enzyme to live and replicate inside the body. So therefore, PrEP prevents HIV before it could even replicate inside our body. So it's composed of two antiretroviral drugs in one tablet. So for your information lang, it's a nucleoside reverse transcriptase inhibitor as we've discussed. So next slide, please. So to date, there are more than 15 clinical trials that actually provide evidence for its effectiveness. It's dubbed as a game changer in HIV prevention, and PrEP has been documented to provide up to 99% protection if taken as prescribed. In fact, in an extension of the IPREC study in 2014, it was documented to provide 100% protection if taken at least 4 out of 7 pills per week, and 84% if it was taken 2 to 3 times per week. So in our local setting, we've had this PrEP project in Love Yourself. And among the pioneer users of PrEP, there has been no new infection since when we started the project. And so it is comparable to what probably the most HIV prevention tool, which is condoms. So it's comparable to correct and consistent condom use because it prevents HIV with 91% efficacy among gay and bisexual men. So medyo comparable. So greater than 90%, PrEP 99%, condoms 91%. So comparable naman. So it's best actually used together. So ito lang, we need to emphasize that there's near zero new infections upon using PrEP if taken as prescribed. So next. Currently, it's really easy to use. So it's taken orally daily. So for men who have sex with men, there is an option to maximize the pill by doping an event-driven approach, meaning kung kailan ka lang may kipag-sex, pwede mong gamitin. So ito yung tinatawag naming 2-1-1. So it's quite complicated to actually explain here, but when you start using it in that manner, it's actually easy to understand. But for the benefit of our time, I won't expand on that. But there are a lot of ways wherein you can actually make most out of your pills. And in the future, there are lots of options in the research pipeline. In fact, there's a very promising injectable PrEP coming, and it has shown better efficacy over oral PrEP. So it's really exciting. With the convenience of removing the fact that PrEP has to be taken daily because injectable options are actually given every 2 weeks. So it's easier than taking your PrEP daily, right? So next, in terms of safety, I know some of Filipinos most likely will be hesitant on taking medications, of course, but it is really safe and well correlated by the body, meaning wala siyang masyadong side effects, in fact. So personal experience lang, since I've experienced using PrEP, minimal side effects. Most common mostly will be nausea. If maka-experience kayo, nausea meaning parang naduduwal pero hindi siya masyadong nangyayari. Siguro would mostly be around 2 to 5% of those people who are using it. Either way, kung ano man yung mga side effects that there is, don't worry because your doctors on your community will actually look after you while you're using it. So the benefit will always outweigh the risk of having HIV infection. So you're safe. Okay, next. So currently, in terms of its access, it's still a prescription drug. So hindi mo siya mabibili over the counter. Kunwari gusto mo pumunta sa drugstore and you're gonna look for PrEP, wala pa. So, kasi kailangan ng prescription. So, it's mostly dispensed by private doctors and Love Yourself community centers and sexual health clinics. So, it costs around 1,500 to 3,000 pesos per 30-pill bottle. So ito, share ko lang, sa other countries, actually, covered siya by government and private insurance, diba? So parang sana all. So para kasi ganun siya ka-important for some, ganun siya ka-proven and effective for HIV prevention, right? So next. So when bashers say that this might actually increase promiscuity or parang mas magiging complacent yung mga tao, actually evidence say otherwise. So multiple studies have documented that there's no increase in condom-less anal sex sa abroad. And even in our local studies, actually, sa PrEP project na Love Yourself, so condom use was only decreased with steady partners. So ito yung partner mo naging consistent na. And there was no actually increase in number of sexual partners. So dito natin masasabi na ito kapag nag-PrEP na yung mga tao, mag-sex na lang sila mag-sex. Actually, yes, that's true, but hindi naman siya risky. Especially if we combine it with other prevention options such as condom and HIV and regular HIV testing. Right? So next. So taking all into consideration, there are some key takeaways when it comes to PrEP. So number one, PrEP is actually safe, and then PrEP is actually effective. And lastly, it is actually your choice to make. So next. All right, so thank you everyone. I hope you learned something today.
Yeah, thank you, Doc Patrick, for that in-depth discussion about pre-exposure prophylaxis or PrEP. Ang dami kong natutunan ha. So sa madaling salita, ito yung gamot na iniinom ng isang HIV negative person bago siya ma-expose sa HIV para hindi siya ma-infect ng virus. Please comment on your thoughts and questions and we'll try to address those later on during our panel discussion. Also, please share and retweet this webinar so we can educate others about new ways to prevent HIV. Don't forget to use our official hashtag #SaferNowPH.
Taking PrEP, actually, I was very scared of possibly getting HIV and AIDS because of my sexual encounters. But you know, I would always use condoms because I know that's how I primarily can protect myself from contacting the virus.
I guess you could say it still runs the same cadence as it does now. But the difference is I was a lot more conscious about who I was sleeping with and how often I was sleeping with multiple partners.
Well, I've always been someone that's very active to sex. So yes, I use apps like, for example, Tinder, Bumble. That's where I usually find my sex partners. I'm aware of the consequences of unprotected sex. So as much as possible, I use condoms, but if I'm honest, there are some times that it is unprotected. I have sex work experience. I do it for income generation.
My sex life prior to PrEP. I've been to several long-term relationships before. Yung pinaka-longest relationship was 7 years. At that time, we didn't use any protection. Parang idealistic ako na because I wasn't in a monogamous relationship. I'm basically okay with it. There are times that I would have, I would use protection, but sometimes it's not always the case na that I would use condom when I have sex. At the back of my mind, I know that I am putting myself at risk, and there's always that looming sense of dread after a sexual encounter. I'm Marvin.
I'm Franco.
And I'm Audrey. That was the first of a series of testimonial videos from PrEP users like me and Martin. Hear more about how PrEP affected our sex lives and relationships in the next few days on Skipa Philippines Facebook page. The Philippine National HIV Prevention Month is not just about awareness, but also about support. Here with us today is the lead convener of the Kalasag PrEP Service Delivery Network, Mr. Danvic Rosadiño, to briefly talk about this online PrEP peer support group. Hi, Danvic!
Hi, Janly. Hi, Marvin. Good afternoon sa inyong lahat.
Kamusta ka?
Okay naman. Syempre, tuloy-tuloy pa rin naman tayo sa pagbigay ng service sa ating community. But I'm happy to share a good news sa kanila, especially to our PrEP users and those people who are intending to use PrEP.
Thank you so much for taking time this afternoon and take the floor.
Okay, so for those people who are taking PrEP or are interested to take PrEP, we have a good news for you as we are establishing a new avenue for you to collaborate and to discuss concerns about PrEP. We are launching the Preppy Circle. So the Preppy Circle is an online safe space for sharing news, updates, and other information about PrEP use. It is also a virtual hub where one can interact with fellow PrEP users on their experiences and concerns, and for learning more about PrEP if someone is still considering to use it. In the next few weeks, we'll be populating the group with online resources on PrEP and a national directory of facilities providing PrEP services. We'll also explore setting up a mentorship feature where one can ask designated trained PrEP peer counselors on some of your more private questions regarding PrEP. Para you can ask them privately if you have any questions and concerns regarding PrEP. So we invite you to join the Preppy Circle, your online safe space on anything and everything about PrEP here in the Philippines. Join the group by searching it on Facebook at Facebook groups, the Preppy Circle. Thank you very much.
Wow. Danvic, paano ba sumali and what can we expect in joining this group?
Well, technically, anyone can join. Either you are a PrEP user already or you are still interested to take PrEP. We envision the Preppy Circle as an online support group where people who are taking PrEP can support those people who are already taking PrEP, and magbigay din ng support for those people who are considering to take PrEP. Kapag may agam-agam pa sila, they can provide, and they can answer the questions and concerns that they may have. So parang the community supporting the community.
Nice.
So clear naman pala na hindi kailangan na naka-PrEP na, no?
Correct. Kasi, anyone can help people naman eh. So, for those people who are taking PrEP, they can guide people who are not taking PrEP. Kasi I'm sure baka yung mga taong gusto mag-take ng PrEP, we understand that they may have some concerns and questions that they want to know before deciding. Kasi it's ultimate the client's choice naman eh if they want to take PrEP. So, we envision that this is an online safe space para, makachikahan sila regarding PrEP.
Oh, nice. Thank you, Danvic, for that wonderful initiative of providing a platform for existing and prospective PrEP users to talk about their PrEP concerns and experiences and just all around share knowledge about this preventive measure.
Tama nga naman. Magandang meron talaga tayong karamay para mas mapagtagumpayan natin ang laban kontra HIV. So Danvic will still be with us during the Q&A portion of the show. So if you have other questions for him, kindly save those for later. Ngayon, muli rin kaming nagpapasalamat sa mga karamay natin sa pagsulong nitong National HIV Prevention Month 2020.
Correct. The hashtag SaferNowPH Combination Prevention Campaign and National HIV Prevention Month celebration is spearheaded by the Global Fund SKIPA Philippines and Champion Community Centers Network, co-presented by AIDS Healthcare Foundation, sponsored by Rotary Club of Cubao, Quezon City District 3780.
This hashtag SaferNowPH webinar on PrEP and PEP is also brought to us by Durex, Lovet, 3M, Bliss4, Luby, Chlorelief, USANA Philippines, Easy Lubricating Jelly, Premier Condoms, Liquor Bouquet Philippines, and supported by UNAIDS Philippines, Filipinas Shell Foundation, the Sustained Health Initiatives of the Philippines or SHIP, Australian Federation of AIDS Organizations, APCOM, and Love Yourself Inc. Please don't forget to like and follow our social media pages. Philippine National HIV Prevention Month on Facebook, Twitter, and Instagram at HIV Prev Month PH. And Champion Community Centers on Facebook.
Hi, I'm Katrina Gray, your Miss Universe 2018. Love Yourself, a community dedicated to empowering one's self-worth, introduces PrEP Filipinas, a new way to prevent HIV. Yes, you heard it right, prevent HIV. How? Through a daily pill called the pre-exposure prophylaxis, or simply PrEP, which enables your body to resist HIV by more than 90%. PrEP is FDA approved, although we advise to talk to your doctor in regards to any potential side effects. PrEP adds another layer of protection to feel safer and more empowered against HIV. But remain consistent with use of condoms and lubes, since PrEP does not prevent any other sexually transmitted infection. But with PrEP, you are better in control of your sexual health by preventing HIV. So prepare yourself and see a doctor. PrEP Filipinas is out and available. Because with PrEP, you are ready to be safe.
In the past half hour, we've learned more about PrEP and the newly launched online support group for it. This time, we are now going to explore the other side of the coin, ang post-exposure prophylaxis, or PrEP. I am honored to present to you one of the seasoned physicians in the HIV community to talk about introducing non-occupational PEP in the Philippines. Help me welcome her by hitting that love button for Dr. Kate Leyritana, Medical Director of the Sustained Health Initiatives of the Philippines Incorporated, or SHIP. Good afternoon, Dr. Kate.
Magandang hapon, Marvin. Thank you for inviting me here to talk about non-occupational PEP.
Okay, Doc. I won't keep you from doing your thing. Take it away, Doc Kate.
So maraming salamat at magandang hapon sa mga nanonood today sa Safer Now. I'll be talking about non-occupational post-exposure prophylaxis. So to differentiate this from the other type of PEP, which is occupational, ang non-occupational events of exposure occurs outside the healthcare setting. So ito yung mga usually sex-related or surrounded by injecting drug use circumstances. So next slide, please. So imagine the scenario. You're in the middle of having sex when suddenly, bigla kang nagulat. Wala pala akong suot na kondom. Or, next, nasira yung kondom. Or, pangatlo, nawala yung kondom. Kanina nandito yun. Okay. So, bad trip siya, di ba? Nakakainis. Napaisip ka, anong gagawin ko? So, napaka-downer, napaka-bad trip ng sitwasyon ito. Next slide. Dito papasok yung konsepto ng post-exposure prophylaxis. So, opposite dun sa sinabi ni Doc Pat kanina sa pre-exposure prophylaxis, when post-exposure prophylaxis is needed, nangyari na yung event. So, na-expose ka na sa isang bagay na ayaw mo sanang makuha, tapos iinom ka ng gamot, click this, para hopefully hindi tumuloy ito sa sakit. So ang PEP ay hindi bagong konsepto, no? Marami na tayong mga health conditions na kung saan nagagamit ang PEP. Example, rabies, 'di ba? Sa rabies nagpapa-anti-rabies vaccine tayo kapag tayo ay nakagatnan ng aso. Or tetanus, Hepa A and B, chickenpox, influenza, and now HIV. Next slide. So to know how it works, kailangan malaman natin paano bang nangyayari kapag na-expose tayo sa HIV. Anong nangyayari sa katawan natin? So, sana makita nyo ito, no? When we are exposed to body fluids of our partners who carry the HIV virus, papasok ang HIV sa katawan natin through breaks in the mucosa layer, whether it's a cervico-vaginal epithelium or sa anal epithelium. The time it takes for the virus from being free in fluids, from it to infect certain cells in the body, takes about hours lang. And then, ang local expansion niya sa katawan takes about 3 to 4 days. So, importante ma-hit natin yung time frame na kung saan hindi pa siya pumapasok sa mga lugar ng katawan natin na kung saan no turning back na. So, dito makikita nyo mamaya yung importance ng window period na kung saan magiging effective yung PEP natin. Okay, next. So, ang tanong, sino ba ang nangangailangan ng NPEP or non-occupational post-exposure prophylaxis? Una, kailangan nating i-assess, no? Meron bang substantial risk yung pagkakataon ng exposure natin at yung mismong source o yung partner natin? So later on, I'll discuss what does substantial risk mean. And then after nun, iisipin natin, nandun ba tayo sa golden window of 72 hours? Bakit 72 hours? Tulad ng nalaman natin kanina, the effectiveness of PEP is highest when it is less than 72 hours. So, kunyari, pasok tayo sa less than or equal to 72 hours. The next question is, ang source ba ay HIV positive? So, hindi natatapos dun yung tanong natin. Dahil sa maraming datos na nagsasabi na kapag ang isang taong HIV positive ay undetectable dahil sa effective na gamot, walang chance na siya ay makakapagpasa ng HIV sa ibang tao. So ang next question mo ay, kung HIV positive man siya ba ay undetectable or hindi? So malalaman lang natin to kung meron siyang viral load na alam niya at kung alam natin na iniinom niya yung gamot niya everyday. So kunyari, undetectable pala yung ating HIV positive source. Case to case na. Kasi isipin natin, maniniwala dapat tayo sa siyensya na undetectable is untransmittable. Di dapat kampante tayo na okay lang yon, hindi ako mahahawa kasi undetectable siya. Pero paano kung hindi siya undetectable? Or kung undetectable man siya dati, tumigil siya ng gamot niya lately. So yon, pwede tayong maging candidate to receive NPEP. Okay? Ang isa pang question is, hindi ko alam ang HIV status ng aking partner kasi hindi namin siya napag-usapan. Or, sinabi man niyang hindi siya positive, parang meron akong trust issues. So, pag ganon, case to case, okay? Mag-uusap tayo niyan, ikaw tsaka yung doktor mo, pag-uusapan nyo na substantial risk ba talaga. And then, magde-decide tayo kung mag-candidate ka for NPEP. Okay? Next. Next po. Okay. O yan. So, this surrounds the substantial risk issue dun sa incident. So, yung exposure ba natin ay risky? So, ito yung iba't ibang mga posisyon, ng sex at yung risk niya for HIV transmission kung ang partner mo ay HIV positive and not on meds. So, nakita nila na out of 10,000 exposures, ito yung mga percentage risk mo para doon. So kung nakita natin, ang pinakamataas na risk is pag receptive anal ka or bottom. So also, ejaculation is a factor. No? Nalaman nila na the presence of ejaculation poses a higher risk versus yung hindi nag-pump. Okay? Negligible ang risk ng oral sex and biting, spitting, sex toys, etc. Ano pa yung mga factors na nag-i-increase ng HIV transmission maliban sa posisyon? Kung merong STD, lalo na yung may ulcer na STD like syphilis, kasi may uka na yung inyong epithelium, mas madaling makakapasok yung body fluid carrying HIV sa katawan. Okay? Pangalawa, kung ang viral load ng source natin ay mataas. Okay? Kasi syempre heavy yung burden, mas madaming virus yung papasok. And pangatlo, nakakababa ng risk of transmission among heterosexual males kung sila ay huli. Okay? Next. So, paano naman yung sa exposure ng body fluids? Saan siya risky at saan siya hindi? So, substantial risk siya kung na-expose ang mucous membrane or non-intact skin, may break na siya, or percutaneous, meaning natusok ang blood, semen, vaginal secretions, rectal secretions, and any body fluid with visible blood. And all other body fluids, negligible yun. Okay? Okay. Next. Okay, paano naman tinitake ang PEP? So usually, depende yan sa regimen na ibibigay ng doktor mo kung siya ay once a day or twice a day. It is taken for 28 days. Kaya ito yung calendar mo, 28 days mo siya iti-take. Ito yung findings sa animal studies. Okay? So meron tayong regimen na para sa adults and adolescents. Meron din para sa bata, sa buntis, at yung mga merong kidney problems. Next po. Ito ang importanteng tanong. Siyempre, gusto mo malaman effective ba yung inumin mo for 28 days. So, the thing is, studies surrounding non-occupational PEP are konti lang. Kasi hindi ethical na withhold mo yung dapat na gamot sa isang tao para lang pag-aralan siya. So, ang nangyari is, nag-observe na lang. No? Nag-observe tayo ng mga scenarios na kung saan pwede mo i-conclude na ito yung post-exposure prophylaxis. So, example number 1, OPEP or occupational PEP. Ito yung mga healthcare workers na nagkaroon ng needle stick injury. So, binigyan sila ng single drug, which is zidovudine, at nalaman nila na 81% reduction in transmission. So, ito yung ginawa ng mga 1980s, 1990s, pero isipin nyo, one drug lang ito. Ngayon, ang PEP is either 2 or 3 drugs. So, iisipin mo, baka mas mataas na ang pag-reduction sa transmission ngayon na mas maraming gamot involved. Second, yung mga sexual assault cases. They found out sa mga bata at sa mga adults and adolescents na kung saan binigyan sila ng PEP after a sexual assault, walang seroconversions na na-document. Yun nga lang, may caveat kasi ang pangit ng follow-up rate. Kumbaga, na-take nila yung PEP pero hindi na sila nagpa-HIV test pagkatapos. Pero sa mga nagpa-test, nalaman nila na walang seroconversion. So, ang pangatlong scenario na kung saan may prophylaxis is yung mga mother to child. So, ito alam na alam natin to, no? Taking HIV medications for the baby, ng baby pala, reduces transmission from mother to child kahit na ang mother nila ay HIV positive. And lastly, yung animal studies involving mostly rhesus macaques or mga monkeys. So, sa monkeys kasi, pwede nilang eksperimentuhan yung dami ng viral inoculum, kung ilang araw i-take yung PEP, at kung ilang araw yung, kung ilang oras yung pinakamaagang i-take yung PEP. So, considering this, nakita nila na 89% yung lower risk of seroconversion with PEP. So sa animal studies din natin nakuha yung 72 hours na golden period at yung 28 days na duration ng PEP. Next po. So gaano ka-safe naman ito? So gaya ng sinabi ni Doc Pat kanina, usually side effects are just gastrointestinal in nature. Of course, with any other medication na tinatake mo na bago, rare, pwede ka magkaroon ng allergies, pero this is rare. Yung kinakatakutan na long-term side effects ng mga antiretroviral sa mga PLHIV natin is hindi mo makikita sa PEP dahil ika nga 28 days mo lang ito matitake. So ang exposure mo ay napakilipit. Next. So anong involved? Kunyari, nag-qualify ka as to get NPEP. Anong involved sa prosesang yun? So, magsisimula tayo sa risk assessment. Gaya ng ginawa natin kanina, we will assess the situation and yung source. Of course, you will do an HIV test kasi ang PEP para yun sa HIV negative. Kapag HIV positive ka, mag-ART ka na. We will do also other tests to determine kung meron kang contraindication to the current PEP regimen that is given to you. And also, we will run also some STD tests kasi it was an unprotected encounter, and if you have the risk for getting HIV, you might also get the risk for getting other STDs. We will do counseling, especially for adherence kasi the effectiveness of PEP will rely on you taking it the proper way. We will also advise repeat HIV testing in 3 and 6 months. And if you think that you might need more consistent protection, you might also consider taking PrEP. Next. So of course, may mga documented sa mga studies natin about NPEP failures. Ito yung nag-take ka ng NPEP pero eventually magiging HIV positive ka din. So anong mga sitwasyon nangyayari ito? Number 1, seroconversion, or ibig sabihin, nasa window period ka ng HIV pero hindi to na-detect nung ikaw ay magpapa-evaluate for NPEP. So negative ka, pero in fact, positive ka na pala. Hindi seroconvert ka pa lang. So all along, akala mo negative ka, pero hindi. Okay? Number 2, poor adherence. Kaya importante yung counseling. 3, continued risk after NPEP. So nung nag-NPEP ka, after nun, na-expose ka na naman sa unprotected encounter. And 3rd, transmitted drug resistance. Ito yung ang nakuha mong exposure ay virus na meron ng mutation at resistant siya sa PEP na i-take mo. But this is not very common. Okay? Next. Okay, so naghanap ako, ano ba ang access ng PEP? Regional muna, ito yung kapitbahay natin. So if i-Google map mo, Google search mo, where to get HIV and PEP, near me, so Australia, ang dami, bawat region sa kanila meron. Itong sa upper right, ito ay Bangkok, Thailand. Meron din sila, may network din ng mga clinics doon. Sa lower left, ito ay Singapore. And sa lower right ay Hong Kong. So yung mga kapitbahay natin, ang daming accessible PEP places. Kasi nga, in fact, sa kanila, it should be available in all hospital emergency rooms. Next. Sa Pilipinas naman, okay, sa kaliwa, where to get HIV PrEP, swerte tayo. Ayan, 18 results yung lumabas. Okay? Pero pag tinanong ko where to get PEP, walang lumalabas. Because siguro ngayon pa lang tayo nagiging aware na dapat meron tayong access to post-exposure prophylaxis. Pero for now, sa mga Love Yourself clinics, merong NPEP, sa SHIP, at sa Mindanao, sa CDO, sa NMMC, meron. At sa Cebu, meron din tayo. So, at least meron tayong isa sa bawat rehiyon ng Pilipinas. Next. So ano naman ang in-store sa future ng NPEP sa atin? So ang meron tayong guidelines ay occupational PEP. Ito yung sa mga healthcare workers noong 2009. Coming soon ang non-occupational PEP guidelines kasi na-mention na din ito sa ating 2020 revised ART guidelines for people living with HIV. Ang PrEP guidelines naman for the year ay being finalized. So we're looking forward to a lot of new things. So hopefully makascade down sa ating mga healthcare providers all over para magkaroon tayo ng access sa both occupational PEP and non-occupational PEP. I think that's my last slide. Thank you. And yan nga. So yung campaign natin is PEP para sa extra protection.
Thank you so much, Doc Kate. Alam nyo, share ko lang ha, 6 years ago, back in 2014, wala pang actually program for PEP. Doon ko na-meet si Doc Kate at tumulong siya sa akin na binigyan niya ako ng PEP dahil sa isang risky encounter na naranasan ko back then. Nakakatuwang isipin na napakalayo na ng narating ng mga programa katulad ng PEP at PrEP para sa mga Pilipino na ngayon available na siya para sa public, di ba? Dati kasi parang may, tama ba Doc Kate, na dati parang merong tabu na parang hindi lahat alam na pwede kang kumuha ng PEP. Kasi nga occupational lang yung use ng PEP before. Di ba? So sige, mamaya babalikan natin si Doc Kate sa mga tanong na ito. Pero gusto ko lang siyang pasalamatan personally dahil binago niya ang buhay ko. Thank you, Doc Kate. Kaya naman, we'll stand by for this PEP-focused campaign entitled PEP para sa Extrang Protection. Now, it is indeed clearer to me how to distinguish PEP from PrEP. If PrEP is before exposure to HIV, post-exposure prophylaxis or PEP naman ang agarang lunas na iniinom ng isang HIV-negative person after ma-expose sa HIV at dapat agad itong maumpisahan within 72 hours from exposure.
Tama ka dyan, partner. Madami talaga tayong natutunan today, pero for sure marami pa tayong tanong. Pero bago tayo tumungo sa Q&A, ang National HIV Prevention Month 2020 ay magkakaroon pa ng mga sumusunod na online activity. On August 22, that's the Undetectable Equals Untransmittable or U equals U Day, where we will celebrate the wins of people living with HIV through an online dating show. Exciting yan, ah.
Pwede ba tayong sumali dyan, partner? And on August 29, we'll be culminating our month-long celebration with a fun and gamified discussion on HIV combination prevention because learning HIV prevention can also be very fun.
May isa ba tayong aabangan, partner? Later on in the show, we will be also announcing the winners of the 33 winners of our 3 PrEP contests on Facebook, Twitter, and Instagram. They will be receiving 3 months worth of PrEP supply. Isn't that fantastic?
Grabe, sana all, di ba? 33 ang dami, but congratulations sa kanila. At to learn more about not just PrEP and PEP, but combination prevention as a whole, please check out our Safe Spaces PH chatbot at m.me/safespacesph.
Welcome back. This is the National HIV Prevention Month 2020 hashtag Safer Now webinar on PrEP and PEP. Earlier, our guest speakers, Drs. Patrick and Kate, discussed all we need to know about PEP. But wait, there's more. We're lucky to be joined today by three more HIV experts para sagutin ang inyong mga katanungan. Again, from the Kalasag PrEP Network, Danvic Rosadiño. We also have the chair of the hub at Manila Doctors Hospital, Dr. Ann Joy Aguadera, and the World Health Organization Philippines HIV consultant, Mr. Kenneth Samaco. Good afternoon, guests. Or good evening na pala. Good evening, guests.
Good evening, guests.
Good evening, Marvin. Good evening, Janly.
Hi, Danvic.
Good evening.
Hello, Dr. Aguadera. And
Magandang gabi.
how are you tonight?
I'm good. How are you tonight?
Great. Fabulous. And thank you for being with us. Ayan. So,
All the time.
for our viewers, just comment your questions and we will entertain them one by one. So I think, Marvin, you have a question?
Okay, sure. Let's start with this first question. Our speakers have mentioned about PrEP and PEP guidelines from WHO and other international bodies. Ano naman ang stand ng DOH and medical societies natin on offering PrEP and PEP in the country? Perhaps can Doc Kate and Dr. Aguadera can share?
Okay. Maybe I could start, and our colleagues can supplement. Currently, what the program is doing in terms of advancing the availability of PrEP in the country is that there is a faster development in terms of the national guidelines on PrEP. So, nangyari na po nito ay it has undergone series of revisions so that it would tailor fit to the needs of the community and make it more context relevant right now. For PEP, I have to say that it's still limited amongst the occupational exposure, but if there will be a demand in the community and based on the WHO guidelines, which was available since 2014, the recommendations for PrEP, irrespective of exposure scores and recognition of the need to simplify eligibility assessment and prescribing practices. So there is really a need or a call to translate these guidelines into national PEP policy. So countries are highly encouraged to consider this need to provide PEP in the way that it maximizes uptake and of course the completion rates. But for now, it is very crucial or important that there are also, or to recognize that there are also other non-pharmaceutical ways to prevent or ways in acquiring HIV. So please, we highly encourage everybody to visit or consult their nearest sexual reproductive health clinics so that they would be advised on which prevention packages that would tailor fit to their needs.
Thank you, Dr. Ken. So, as Sir Ken, salamat. So, I would just like to share also our experience in Manila Doctors. Bago lahat, I would just like to say thank you to the organizer, Love Yourself, and the different sponsor that despite this challenging time, they still continue to have this kind of activity, which is very important in today's activity. For Manila Doctors, as our name stands for, which is the HIV undetectable being, our goal really is for individuals to be undetectable. And in line with that, when we started to become a treatment hub, there's a lot of clamors and requests for PrEP in our institution. Because of that, in the beginning, most of the time, the PrEP was just for research purposes. And most of the clients that comes to Manila Doctors, we need to refer them to our partners in Asia, like most of the time that our clients can afford to go there. So we refer them to Access PrEP. And in line of that, in preparation, even though there's really no clear, but WH has had a lot of guidelines already. We prepared already some doctors. That is why Manila doctors, as early as August 2019 last year, we started to have our prep diploma certification. It was conducted for the benefit of different doctors, especially those in Society for Venerologists and healthcare providers, the occupational health doctors. And they were really open to that. The workshop for the PrEP accreditation workshop training program during that time was geared for the doctors, but um, majority also of the participants came from the positive community. And in fact, they were really very open about it. And we have our second certification workshop on PrEP last, and I think Love Yourself was really part of it. Marvin, you remember you were part of it.
Yes, I was there.
And yeah, the two batches, I believe you were there. And the last batch was on before the lockdown. That was on February. And the next plan before the COVID pandemic was to uh, move it to Visayas and Mindanao, because there's a lot of clamor for the PrEP certification, because we are really preparing the healthcare provider that they would be equipped in prescribing PrEP. If there's a request for PrEP, they will really be equipped with that. And our target was also for training of trainers, and I think Danvic was also part of that. In we want to conceptualize that there will be training of trainers, so that it's going to be cascade down also to those direct service providers. That is our experience, because our priority really is that sexual health should be an individual choice. That it should be a sex positive attitude in all of those aspects. That it is safe, exciting, pleasurable, but with respect, there is no sexual coercion in the things that they're going to do. So it's really more of an empowerment of an individual in their own sexual health. So our experience was really to equip the healthcare providers, and they're really open to that. Because of the pandemic, we were not really able to push through with that. So it will be dependent on the climate, and then probably will push through with it next year. So that is just our experience. We are more on the program and giving it to those who really needs it. So that's all that I can share. So I think Kate is more experience on that. Okay.
Yes, ma'am. Um, I'm happy that PrEP is being, kumbaga, ang tawag doon, yung niro-roll out na sa mas maraming mga lugar. Before, very, very few institutions and groups were able to provide PrEP, and it had to take the operational study of Love Yourself to actually start the ball rolling para makascade down, and now it's nationally available. And my wish is really for PrEP to be available in every province, kasi mahirap kapag limited lang talaga siya sa mga urban settings natin, because anybody can benefit from PrEP. I also wish to see the same with PEP, non-occupational PEP. I think it will need to take the guidelines for every healthcare delivery system to finally be on the train. No? But make no mistake, there are places wherein you can actually get NPEP. For OPEP, it's mandatory for all treatment hubs to be able to provide. No, so if you're a healthcare provider and you have exposure to occupational transmitted HIV through a needle stick injury or a mucosal splash, go to any treatment hub and they will provide you the meds for free. So sad to say, free is not the term to apply to PrEP and NPEP. So these are not free of charge. You have to shell out. Hopefully, we can see in the future that it can be supported in kahit papano by our government, kahit partial lang.
Thank you so much, Doc Kate, Mr. Ken, and Doc Aguadera for your very informative answers. Ngayon naman, I have a question related to myself. Syempre, as a transgender woman, I have taken PrEP and PEP, both PrEP and PEP. My question is PrEP and PEP safe for our transgender siblings? Wala bang contraindications, especially for those who are taking hormones, like myself? Maybe Doc Pat can answer.
Hello. So when it comes to PrEP and transgender women, yes, it's actually really important. It's really an important option for transgender women to actually explore pre-exposure prophylaxis. It's safe. One of the most recent studies, probably na very relevant when it comes to PrEP use in transgender women, is the recent study of Thai Red Cross, wherein they showed that transgender women taking hormonal replacement therapy or estrogen and alongside with PrEP, bumababa yung levels ng isang drug na component ng PrEP. However, it doesn't mean na yung clinical effects niya every day. Yun yung kailangan po natin i-emphasize kasi unlike men who have sex with men na pwedeng magkaroon ng option wherein they can take it intermittently, transgender women is still recommended to take it daily para yung levels ng PrEP will be protective and hindi ma-compromise yung kanilang need for if ever they need hormonal replacement therapy.
That's good to know, Doc Pat. So para sa ating transgender siblings, it's safe for you to take PrEP and PEP while on hormones.
Okay, next question naman tayo. This one is for Mr. Ken at saka si Doc Aguadera. How is PrEP demand and consumption sa clinics na nag-offer nito? And what can you say about people saying that PrEP only encourages people who have unsafe sex?
Thank you for that question. The idea of having PrEP available in the community is basically to provide additional prevention methods. Because as you all know, prevention is not really like condom na one size fits all. So there are individuals who can abstain, who can be faithful, who can use condoms. But of course, it's basically enforcing the behavior of practicing safe sex and basically being sexually responsible. So it doesn't promote promiscuity because we've already discussed this issues before with condoms. But for us in WHO, it's basically providing an additional prevention methods for those who may need it.
In our institution, PrEP is really available in our pharmacy, and we have it available so that clients will not have to wait for any clinics of the doctor to be open to get that medication. So MedX, our pharmacy, carries the medication, and our doctors who are trained in our hub, and even though they are not connected in Manila doctors, they can prescribe it, and then it is being honored in our pharmacy if they prescribe PrEP. In terms of the way people perceive that, bakit ka gumagamit ng PrEP? Ano ba? Siguro sa tamang pananaw yon na dapat hindi, when we started to talk about it, hindi dapat pag-usapan yung race, dapat pag-usapan na may control ka sa sarili mo. It's really more of control of your own sex life. And a lot of people would say, ito yung, it's just how we need to educate also people na ito, mataas pa rin yung stigma and discrimination. Kaya importante talaga na anong tamang mensahe ang binibigay natin sa mga tao. Kaya nga ang Manila doctor is HIV undetectable being. Oo nga, may HIV ako. Ano ngayon, undetectable naman ako. Oo nga, may HIV ako, pero hindi ako makapaghawa ng sakit na ito. Kaya it's really empowering them na hindi na kami magtatago na, HIV ka ba? Ito, manghahawa ka. Hindi, undetectable ako. Kaya nga medyo strict yung aming, kasi gusto namin na dapat empowered ka. Dapat you are part of the solution also if you are infected. So, undetectable dapat ang goal mo if you started to take antiretroviral. So, yun lang.
Siguro if I may also add then, with regards to sa demand na what we experience in Love Yourself clinics at sa aming mga partner community-based organizations, there is really an extreme high demand for PrEP. In fact, when we set up our sign-up page, we have registered around 25,000 people who are interested to take PrEP. However, it doesn't translate into demand now because of many reasons. Syempre, not all people can afford the price of PrEP. However, what we envision in the future is sana meron ding mga other options for those people that can access PrEP, especially for those who cannot pay for it. Kasi health is, it's for all. At sana, no one gets left behind. And also what we also want to share to those people siguro who are thinking na they might be more promiscuous if they are taking PrEP. Actually, PrEP is actually our responsibility because health is our responsibility. We don't depend yung ating kalusugan from other people, diba? So if we want to protect ourselves from, from the other factors that is out there, then, it's very rightful for us, to engage into this protective measures. So I think it's right lang. Wala namang problema.
Thank you, Danvic, Doc Aguadera, and Mr. Ken. Next question for Doc Pat. Pag nasimulan ang PrEP, do we have to take it forever? Paano if you decide to stop taking it na?
Okay, so thank you for that question. Actually, very common question siya, especially sa clinic when we dispense PrEP. Ang maganda sa PrEP is that as long as you take it as prescribed, you're going to be safe. So as long nandito din kasi yung part na aside from the advice of the doctor, syempre may sarili kang decision and yung peers mo, diba? So kaya nagkaroon ng support group, etc. But when it comes to stopping PrEP, it's actually your decision. Especially if you think you currently have a stable partner or you don't want to engage in too much sex already, or if you want to explore other options when it comes to prevention, or at some point biglang nag-reactive ka, HIV reactive because of a decision you made. So and may mga reasons tayo why people actually stop. You're of sound mind, and as long as you have people to support you and you have your doctor's advice, it's always going to be safe for you to stop and to restart if ever you want it again, or if ever you can take it again.
Wow, that was a very productive and enriching session. Thank you very much for entertaining the questions to our guests. Thank you, everyone. Before we proceed,
I think Doc Kate has something to add. Maybe you can insert it briefly, Doc.
No, I agree wholly with what Patrick says. You can stop PrEP if you think that you are not anymore at risk for getting HIV due to the many factors na na-mention naman niya. And before starting PrEP lang, just consult with your doctor to make sure that you are still indeed HIV negative before you do that.
Okay, thank you very much, Dr. Aguadera. Thank you, everyone. Doc Patrick, Doc Kate, Danvic, Ken. Thank you, everyone. Before we proceed with announcing the winners of the free PrEP contest, allow me to show a special promo from Bliss 4. In buying one limited edition Bliss 4 Kama Sutra card deck featuring 54 unique sex positions, you'll also get one free case that's 96 pieces of sex-driven condoms. Avail of this promo on Bliss 4's official stores on Lazada and Shop. Thank you, Bliss 4.
Ayan. So, allow us to, parang gusto ko yan, partner, ha? Share tayo dyan.
Yeah.
Anyway, allow us to acknowledge once again our partners and sponsors for the celebration of the Philippine National HIV Prevention Month. This initiative is spearheaded by the Global Fund's KIPA Philippines and Champion Community Centers Network, co-presented by AIDS Healthcare Foundation, sponsored by Rotary Club of Cubao, Quezon City, District 3780.
This hashtag Safer Now PH webinar on PrEP and PEP is also brought to us by Durex, Lovet, 3M, Bliss4, Luby, Flow Relief, Ustana Philippines, Easy Lubricating Jelly, Premier Condom, the Curve Bouquet Philippines, and supported by UNAIDS Philippines, Filipina Shell Foundation, the Sustained Health Initiatives of the Philippines for SHIP, Australian Federation of AIDS Organizations, APCOM, and Love Yourself Incorporated.
And don't forget to like and follow our social media pages. Philippine National HIV Prevention Month on Facebook, Twitter, and Instagram. At HIV Prev Month PH and Champion Community Centers on Facebook.
Ito na. Yung hinihintay natin. Last week, we asked our online followers on the importance of PrEP in an effort to normalize discussions about this HIV prevention measure on social media. 33 individuals across all platforms will each be receiving 3 months worth of PrEP supply.
Wow, grabe naman yung 33 at 3 months worth of supply. Gusto ko rin yan. That's a great start for those who are yet to enroll on PrEP, and big savings naman for those who are already on the program. So without further ado, here are the handles of our PrEP winners from Instagram. At I am Jucris, at Leo_Termulo, at _GamiBoy_, at Tanya_Lape86, at Jai_Salem, at Kaloy 1997, at Lester_1014. Congratulations! According to _GamiBoy_, PrEP for me gives you peace of mind so you can have safe and satisfying sex.
Sa Facebook naman tayo. Here are the winners of free PrEP from Facebook. Brian J. Casas, Mark Velasco, Carl Angelo Ortiz, Side Dak, Jays Del Rosario, BKVK, Albert Baybayon. And this is what Mark Velasco had to say. PrEP is relevant to me because keeping myself happy and healthy is my #1 priority. With this easy, safe, and effective way to protect yourself, PrEP is the next best weapon you will have against another epidemic our country is facing. Well said, Mark. Congratulations to our Facebook winners.
Wow, very Miss Universe ang answer. Siyempre, hindi magpapahuli ang ating winners from Twitter, diba? Here are 19 winners of free PrEP from Twitter. Lester 736597777, Monsterified 19, Day Sura, Way and Wing, Juan Jacobo, Hello Mako Anthony, Shady Ditoy, Chinitong Twink 3, Jen of the Jingle, and Thor the Explorer.
Devil_Baste, Singkit Mako, Pete _Austria, M985899697, Dabo Dog 02, Stud 211, Bagong Salta 69, and Shy Guy. Loving what? Baysura said, I need PrEP because I want to complete my holy trinity of safer, worry-free, and enjoyable sex. Condoms, lube, and PrEP. Wow, that's nice.
I love it. Holy Trinity of sex. Gamitin natin yan. Para kay Shady Ditoy naman, I need PrEP because I want to be more responsible and prepared for the ones I make love with. Tama. While JL Bardillon says, I need PrEP because I know that my safety is my responsibility.
Sabi nga ni Spider-Man, with great power comes great responsibility.
Correct.
Wise words indeed. Congratulations and salamat po ulit sa lahat. The NHPM team will be getting in touch with you using the accounts you used to join the contest to give you guidance on how to redeem your prize. And that partner wraps up our event. See you all next Saturday, August 22nd at 5 p.m. on the same page for our U equals U Day live dating show. Thank you, Jelly, a beautiful co-host, for being with me. It's such a pleasure again. I'm Marvin Natural, and this is the National HIV Prevention Month 2020 PrEP and PEP Day, reminding you that we have more choices now to protect ourselves against HIV. Let's continue rallying for hashtag Safer Now Philippines.
O, tapos na pala. Ayoko pa magpalay tayo, Marvin.
Please.
Thank you for those kind words, Marvin, na natural ang kagwapuhan. Maraming salamat po ulit sa lahat at sa ating guests ngayong gabi. At ako naman po si Jan Lidungka na nagsasabing kayang-kaya nating labanan ng HIV gamit ang HIV Combination Prevention Methods. Patuloy na maging bukas ang isipan natin para tayo ay laging ligtas, malusog at masaya.
Good night, everyone!
Hashtag
Hashtag
Salamat.
PrEP and PEP. Woo!